A system in crisis, its failures expose deeper cracks. The NHS, Britain's cherished healthcare system, is facing a perfect storm of challenges. A recent global IT outage caused by a faulty software update has exposed the fragility of its infrastructure. This outage impacted hospitals and healthcare providers across the UK. It led to appointment cancellations, treatment delays, and immense pressure on an already strained workforce. While a recovery tool has been released, the incident has shaken public confidence. It has highlighted the deep-rooted issues plaguing the NHS. This IT failure is not an isolated event. It is a symptom of a larger crisis. Years of underfunding, staff shortages, and increasing demand have pushed the NHS to a breaking point. The recent outage has only served to exacerbate these existing problems. It has left many wondering if the NHS can truly provide the level of care it promises. The impact of this outage goes beyond inconvenience. It has had real-world consequences for patients. Ambulances were diverted, surgeries postponed, and critical care compromised. The situation has highlighted the urgent need for investment in robust IT systems. It has also underlined the importance of addressing the underlying issues facing the NHS. This recent crisis serves as a stark reminder of the importance of a functioning healthcare system. It has sparked a national conversation about the future of the NHS. As the UK heads towards a general election, the state of its healthcare system is likely to be a key issue on voters' minds. The question remains, can the NHS be saved, or is it destined to crumble under the weight of its own challenges? Faces of the crisis: Nathaniel Dye's story. Behind the headlines and statistics are real people whose lives are deeply affected by the NHS crisis. Nathaniel Dye, a music teacher, is one such individual. Diagnosed with stage 4 bowel cancer, Dye's experience embodies the struggles faced by many within the system. His story is a stark reminder of the human cost of a failing healthcare system. Dye's journey began with a delayed diagnosis. He faced long waits for appointments and scans. This delay allowed his cancer to progress to a more advanced stage. By the time he received his diagnosis, the cancer had spread, making treatment more complex and his prognosis more uncertain. Dye's experience is sadly not uncommon. Countless individuals and families across the UK face similar challenges navigating the NHS. Long wait times for appointments, difficulty accessing specialized care, and a lack of communication from healthcare providers are recurring themes. These systemic issues have real consequences for patients like Dye, impacting their quality of life and chances of survival. His story is a powerful testament to the urgent need for change within the NHS. It highlights the need for increased funding, improved infrastructure, and a renewed focus on patient care. As the UK grapples with the future of its healthcare system, stories like Dye's serve as a powerful reminder of what is at stake. The NHS on the ballot: Labour and Conservative promises. As the UK gears up for a general election, the state of the NHS has taken centre stage. Both the Conservative and Labour parties recognise the public's concern. They have made healthcare a central issue in their campaigns. Each party offers a different vision for the future of the NHS, leaving voters to decide which path to choose. The Conservative Party, in power for over a decade, points to its record of investment in the NHS. They argue that they have increased funding and implemented reforms aimed at improving efficiency. However, critics argue that these measures have been insufficient to address the scale of the crisis. They point to longer wait times, staff shortages, and declining quality of care as evidence of the Conservatives' failure to adequately address the needs of the NHS. The Labour Party, on the other hand, has pledged to increase NHS funding significantly. They promise to reverse what they see as damaging Conservative policies, such as privatisation and cuts to services. Labour has also pledged to address the workforce crisis by increasing training and recruitment of doctors, nurses, and other healthcare professionals. 14 years later, a legacy of underfunding. After 14 years of Conservative rule, the NHS finds itself at a crossroads. Critics argue that years of underfunding and privatization have failed the NHS. Budget increases haven't kept pace with inflation and growing demands. The COVID-19 pandemic exposed the NHS's vulnerabilities. The government points to increased funding for mental health and cancer treatment. Many argue that short-term solutions undermine the NHS's founding principles. As the UK heads towards an election, the debate over the NHS's future intensifies. Section 5. Labour's vision versus conservative reality. The Labour Party has positioned itself as the party of the NHS, promising to rescue it from the brink of collapse. They have pledged to increase funding, reverse privatization, and address the workforce crisis. Their vision for the NHS is one of a publicly funded, universally accessible system that provides high-quality care to all, regardless of their ability to pay. Labour's plans have been met with a mix of hope and skepticism. Supporters praise their commitment to reversing years of underfunding and restoring the NHS to its former glory. They point to Labour's track record of investing in public services and their understanding of the social determinants of health. For many, Labour's vision represents a return to the founding principles of the NHS and a rejection of what they see as the Conservatives' market-driven approach to healthcare. However, critics, often aligned with the Conservative Party, argue that Labour's plans are unrealistic and unaffordable. They question the source of the funding for these ambitious plans and express concern that it will lead to higher taxes. They also argue that Labour's focus on reversing privatization ignores the potential benefits of private sector involvement in the NHS. The debate between Labour and the Conservatives over the NHS reflects a fundamental difference in ideology. Labour views healthcare as a right, not a privilege, and believes that the government has a responsibility to provide it to all citizens. The Conservatives, while acknowledging the importance of the NHS, are more open to market-based solutions and believe that private sector involvement can improve efficiency and innovation. Section 6. A sea of numbers, drowning in waiting lists. Beyond the political rhetoric, the numbers paint a stark picture of the crisis gripping the NHS. Waiting lists for treatment have reached record highs, with millions of people waiting for essential procedures and consultations. These long waits can have a devastating impact on patients' physical and mental health, leading to prolonged suffering, worsening conditions, and a reduced quality of life. The number of people waiting over 4 hours in A&E has also increased dramatically. A&E departments are struggling to cope with the demand, leading to overcrowding, delays, and canceled operations. This situation is putting immense pressure on NHS staff, who are working tirelessly under increasingly difficult conditions. The NHS is also facing a severe workforce crisis. Years of underfunding and a lack of investment in training and development have led to a shortage of doctors, nurses, and other healthcare professionals. This shortage is exacerbating the problems within the NHS, leading to longer wait times, reduced service provision, and a decline in the quality of care. These statistics highlight the urgent need for action to address the crisis in the NHS. The current situation is unsustainable, both for patients and for the dedicated staff who are struggling to keep the system afloat. Addressing this crisis will require a significant investment of resources, a long-term vision, and a commitment to putting patients at the heart of the system. Section 7. Beyond the hospital walls, housing, immigration, and health. The NHS faces pressures from wider societal issues. The UK's housing crisis impacts health and well-being. Poor housing conditions lead to health problems, straining the NHS. Immigration also affects the NHS. The NHS relies on foreign-born staff. Some argue immigration strains public services. They claim it leads to longer wait times and service decline. Others argue immigrants contribute positively to the economy. Immigrants often pay more in taxes than they receive in benefits. They play vital roles in the NHS. Addressing housing and immigration is crucial for NHS sustainability. Fair housing and balanced immigration improve public health and reduce NHS pressure. Can the NHS be saved? The NHS stands at a crossroads. Years of underfunding and rising demand have pushed it to the brink. The recent IT outage highlights the system's fragility. Can the NHS be saved, or will it crumble under its challenges? The answer is complex and multifaceted. No single policy will restore the NHS. A long-term vision prioritizing investment and innovation is needed. Increasing funding is essential, but not enough. The NHS must use its resources more efficiently. It is a system worth fighting for, requiring collective effort for its survival.